Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And we're here at the eClinicalWorks Enterprise Summit. And our guest is Leanne Knight. She's Director of Health Informatics at Pioneer Physicians Network. Welcome, Leanne.
Hi John, thanks for having me.
Yeah, excited for this discussion. I mean, you have such a history with ECW and experience, so I can't wait to learn from you. But before we dive in there, tell us about yourself and Pioneer Physicians Network.
Awesome, thanks. I'm the Director of Health Informatics, as John said, with Pioneer Physicians Network. We have 18 locations across 4 counties in Ohio, all primary care practices, and we service Medicare Advantage lives all the way down to Medicare, all the way down to pediatrics.
Wow, it's interesting to see so much primary care. That doesn't usually happen, so
right.
That's a bit of an anomaly. But yeah, it sounds like you've had some growth. I mean, to be such a large organization. Talk about the growth of your organization and really the role of ECW in that growth.
Well, ECW has been a critical factor in our growth, especially during the times of COVID, right? So utilizing the technology to continue servicing our patients during that time awarded us the opportunity to onboard additional practices during a time when most places were shut down. So we had extreme growth over 2021 to 2022, adding 3 practices, and I'm going to say 5 newly graduating physicians to existing practices, but using the capabilities of technology, telehealth, and training tools that ECW offers. It was pretty seamless.
Interesting. So was the key to having the cloud to be able to do that? And I mean, it's fascinating you grew during COVID. That doesn't happen, but
right.
Was that the key, is the cloud to be able to do it anywhere, or the telehealth tools? Talk to us more about that.
Great. Well, we have been using ECW's cloud for probably half of the time we've been on ECW, moved to the web-based version. So it allowed us to not have to physically touch computers, be in front of people in order to deploy ECW to them. Our team sits in a central business office, so we could conduct training services remotely to these physicians. Certainly we use technology, no longer dependent on paper charts, that can support taking care of the patients alongside ECW's telehealth services.
Interesting. And when I talked to you before, you mentioned that there was a centralization effort that you did when you have that many practices. We see all sorts of things where it's distributed, sometimes it's central.
Right.
How did you approach that?
Yeah, so one of the values that we believe in actually getting new practices to join us is the central services that we offer. And central services has allowed us to offset some of those responsibilities that typically sit at the site level and can be manned at an administration office, allowing those individual practice sites to focus on the point of care patient interaction. It also allows for redundancy. When you're short-staffed, which happened during COVID, you have team-based services, so you can cover one another instead of disbursement across all 18 of our locations. So we have centralized billing services, centralized referral services, centralized document management services. Certainly our IT, informatics, HR services are all there as well. But all of our services utilize ECW in a team-based approach to really support our 18 practice locations.
Well, and you partnered with ECW on the RCM side of things, I think, to facilitate the centralization. Talk about how that partnership's gone.
Certainly. I mean, RCM partnership for their services has really been critical to the success financially for our organization. Our central billing office used to do everything in the billing cycle from A to Z. And partnering with RCM has allowed us to offset some of that work to really a team of specialists that know how to use their technology to automate processes and allow us at the central billing office to focus on those things that can't necessarily be automated. So all of the claims creation, the ERA posting, and all of those specifics that have to be configured by a payer, ECW's technology, and really getting us a dedicated RCM partner to help us through that has allowed us to increase our collections, decrease our days in AR, and we're consistently below standard benchmarks for that. So it really has allowed us great success from a financial perspective.
That's interesting, because I think a lot of people, when they look at things like revenue cycle, they're like, well, we want it close because we want to control it.
Yeah.
But when you do that, you just described, it doesn't allow for the specialization that you're able to get, because obviously ECW is doing that even on a bigger scale.
So and certainly there's plenty of visibility into what ECW is providing for us.
Okay.
I mean, they're working directly out of our EHR, right?
Sure.
So their users have usernames and passwords. We can see from a reporting perspective everything that they're doing, and they have their own set of analytics and standards that they're held to. Sure. They also bring forward to us plenty of opportunities for improvement around that collection cycle that we may not have had the knowledge to identify ourselves, but in recurrent meetings, weekly, sometimes even daily reports, we can get updates, and we know where to focus our efforts on our in-house team to ensure that we meet optimal financial performance.
Yeah, that's awesome. Well, you know, you're a bit like me. You go back to the meaningful use days, the the times where we were implementing all these EHRs, and I'm sure you've seen this evolution of technology. And I'd love to hear, like, how has the implementation of these technologies really enhanced the patient experience over these years? You
know, patients want to control their healthcare, right? And we have to be ahead of the game and ready for them to do that. At our organization, we always want to be the first to do everything. We're not afraid to try it and see if it works. So a lot of the features that ECW has have allowed us to do that. For example, Helo Open Access. Okay. We opened after-hours clinics in our regions to service only our patients. They're not urgent care centers. Right. In 2017, we now have 3 of them open, with the most recent one being in 2022. And it has allowed us to use Helo Open Access to allow patients to make their own appointments, so we don't have to staff as many people at those after-hours clinics. Right. But the real win with that Helo Open Access and our after-hours clinics is those patients that would have went to an urgent care or an ER that chose to see us instead. And then the technology that we had their chart in front of them, right? So had a patient went to an ER or an urgent care, we don't have that information. So guiding them to us and giving them the ability to create their own appointment, that's just one of the many things that really has helped us win, and all during COVID times as well. Yeah.
Well, I think, you know, people don't realize how much patients value open access, you know, because we're scheduling online appointments for everything. I mean, even the bank, you know, I hate comparing ourselves to the bank, the DMV, you know, they all allow it. Like, why isn't healthcare? So it's awesome that you're offering that service. I'm sure patients love it.
Right, they do. And beyond Helo Open Access, I think about the integration of the work that's being done with the payers. Okay. Right? Data from the payers armed with EMR data really is a game changer in our industry of value-based care. And as we continue to expand our contracts with the payers and move into full risk models, the way that ECW has been able to partner with the payers to ingest that data and give us meaningful, actionable information at the point of care is exciting where it's been, and it's even more exciting about where it's going.
Yeah, it's just the beginning, right?
Right.
Now we have the data to be able to do stuff, cool stuff. I love that. Well, Leanne, this was great to learn from you and your experience with eClinicalWorks, and obviously with your organization. So thanks for sharing, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Leanne.
Thanks, John.